Hi everyone, my name is Ayesha and I'm so happy to speak with you today about how the PAN Foundation works with the Parkinsons Foundation. The Patient Access Network Foundation, or PAN for short, has been around since 2004. We're a nonprofit that works with underinsured people with life-threatening, chronic, or rare diseases get access to the medications and treatments they need. Underinsured means that you do have health insurance, but you still have really high out-of-pocket costs related to your prescription medications or your cost of care. Organizations like PAN are able to help you because we can provide you with a financial grant that you can apply towards your out-of-pocket costs. Often, folks who enroll in our programs end up having hundreds of dollars of costs that they have to pay for their medications every month. But with a grant, those costs are reduced to nothing. We're able to help people with Parkinson's disease specifically because we have a program dedicated just for Parkinson's. What this means is that if you qualify, you could get up to 1 year of assistance. And so that 12 months would allow you to have a grant of $3,200 that you could use to pay for your prescription medications. One of the great ways that we work with the Parkinsons Foundation is that we are able to connect folks who come to us looking for financial assistance who also may have questions about other needs. So for instance, let's say someone comes to us and they're very interested in applying for financial assistance, but they also have questions about their disease. And maybe they're looking for additional support tools or wanting to speak with someone who understands what they're going through. That's where this partnership comes in. We're so fortunate to be able to refer our folks that we work with over to the Parkinsons Foundation so that they can reach out and hand in hand with people who are looking for assistance. This partnership has been in place for a couple of years now, and we are so excited by being able to provide holistic care to people who come to us. Let's talk about who is eligible for a grant by the PAN Foundation. Specifically for the Parkinson's Disease Fund, we have 5 eligibility criteria that you must meet. 1, you must be diagnosed with Parkinson's disease and receiving treatment. 2, you have to have Medicare health insurance. So we recognize that some folks might have commercial health insurance, and if you do, we'll help you get over to perhaps the manufacturer copay cards, which might be able to help you. But if you have Medicare health insurance, we'll be able to hopefully help you directly. Third, your medication must be covered on a list of covered medications. And so we put that list together by looking at which drugs are FDA approved to treat Parkinson's. And we also reference guidelines and compendia to make sure we're including as many products as possible that you might need. Next, we require you to be within a certain income bracket. So our program allows folks to enroll who are at or below 500% of the federal poverty level. For a family of 4, that's around $85,000 per year. And so if you are unsure if you qualify, I recommend that you visit us online or you check us out by giving us a call at our call center, and we'll be able to talk you through it and see if you qualify. And lastly, we require that anyone who is enrolled in the fund is a U.S. resident, but please note U.S. citizenship is not required. So check in the comments, and what you can see are the conditions for being eligible for the Parkinson's disease program. Also, there'll be additional contact information there if you'd like to learn more about PAN and what we do and how we work with the Parkinson's Foundation. While this may seem like a lot, we want to do what we can to make it easy and to help you fill out an application and be able to enroll as quickly as possible. And so there's a few different ways you can do this. If you are diagnosed with Parkinson's disease yourself, you could apply online on our portal, or you could give us a call. The application process is pretty straightforward, and regardless of which method you take, whether it's online or over the phone, it's the same process and the same information required. We just ask for demographic information, the name of your medication and diagnosis, your physician's name and information, and then we need your household size and income to verify that income requirement. Once we have that information, we're able to plug it into a system and provide you with a decision immediately. So what that means is if you go online, you hit submit, right away you'll find out whether or not you've been approved for a 12-month grant. Additionally, it's important to note that you don't have to do this all by yourself. If you have a caregiver, such as a spouse, a partner, or a loved one who's helping you manage your condition, you can have them contact us on your behalf, or you can have your healthcare provider or pharmacy do that for you. And if your healthcare provider and pharmacy do that, they're also welcome to call us, or what can happen is they can go online and they have dedicated portals just for them. So that way they can be able to manage multiple people and help them apply for assistance. So when you receive assistance from the PAN Foundation for Parkinson's disease, you receive a grant of $3,200. And that grant's good for 12 months or until that funding is exhausted. So we come up with that number by looking to see what do most folks need and how much coverage will you need in 12 months. And that's where we set the threshold. So we recognize that some people might not need as much, and that's okay. You'll have it if you need it. And we also recognize some people might need more. So if you need more assistance because you've run out of that amount of money and you still have a few months left in your grant period, what that means is you can just let us know. Because we're a nonprofit and we're funded by donations, all programs may open and close throughout the year. Right now, I believe the Parkinson's Disease Fund is open, but a few weeks from now, if we enroll as many patients and don't have funding, the program could close. Not to worry though, if the program does close, what I'd recommend is signing up for a wait list. What this waitlist is it provides a way for you to reserve a place in line. And so that way, when we do receive funding, you're able to fill out an application and get enrolled as quickly as possible without having to do that mad dash when the funds open. Getting yourself added on the waitlist is the same process. When you're calling us to apply or going online to the portal, you'll find out this information right away and be able to fill out the screen. If you need any help doing this, or it seems like a lot, I recommend that you just call us. We have a great team available to be able to help you and walk you through your questions and make sure that you feel comfortable with any information you're providing and to make sure that you understand how to use your grant. We know that often if you have a grant with the PAN Foundation, you might be taking more than one drug. So for instance, maybe for Parkinson's disease, you're taking 2 drugs or more specifically for that condition. That's okay. The grant from the PAN Foundation allows you to submit claims for reimbursement for any of the medications on formulary. And it's not something you need to keep following up with us about either. If your doctor mid-year changes your medication, your dosage, or anything, no problem at all. Definitely reach out to us if your medication is not covered, and we'll see if there's anything we can do to help. But upfront, please know that the grant is available for you, and you'll be able to get the care that you need as quickly as possible. In order to get your claims filed, we work with you, your provider, and your pharmacy. So when you enroll for assistance, we'll send a message over to a healthcare provider letting them know so they have the information handy. Additionally, we'll provide you with the information right away, whether it's online or over the phone, about the information that you can give to your pharmacy. And what your pharmacy will do is they will bill PAN just like they bill any other insurance. So they'll bill your Medicare insurance first, and then any other insurances if you have it, and then they'll bill us. And that happens essentially if you're at the pharmacy, at the retail pharmacy, right there at the store, or they'll do it over the phone if you have a mail order or specialty pharmacy. And when they do that, it takes care of the copay right away, so you do not need to pay anything out of pocket and follow up later to get reimbursed. Again, if you have any questions during that process, let us know, and we can work with you and your provider and your pharmacy to make sure that no questions are outstanding and that we get everything resolved. For the most part, once we have that initial conversation with your pharmacy and provider, if they have any questions at all, you're set, and there's nothing else that you need to do for the remainder of the year. And every time you have your medication refilled, they'll just keep billing us and making sure that the cost is covered. The PAN Foundation overall supports nearly 70 different diseases in addition to the Parkinson's disease. So if you are faced with another chronic, life-threatening, or rare disease in addition to Parkinson's, you are more than welcome to apply for assistance from both programs or multiple programs. For instance, right now we know that there's a lot going on with the COVID pandemic, and it's really hard to be able to just live your usual life before all of this started. And we want to do what we can to help. And so what we've done is we've created a program specifically to support people with the costs related to COVID treatment and prevention. You do not need to be diagnosed with COVID to be eligible for this program. What this program does, it provides people who are eligible with a $300 grant, and that grant can be used towards office visits if you're concerned that you do have COVID and you need to get checked out, telehealth visits. It provides coverage for living expenses such as groceries and meals so that you can stay home and not risk being exposed to others. And so if this is something that could help you, we recommend that you reach out to us. Just like with our other programs, these programs open and close. So if you come to us and the program is closed, please just add your name to the wait list if you need assistance, and we'll let you know when it opens and you'll hopefully apply. We also can let you know about other organizations that may be able to help you, and we'll post that link in the comments below as well. In order to qualify for the COVID program, the eligibility criteria is slightly different from the Parkinson's disease criteria, so it's important to note the difference. As I said, you don't need to be diagnosed with COVID, but you do need to either have a life-threatening chronic or rare disease, and you need to be directed to either self-quarantine by your healthcare provider or your government agency if you haven't been diagnosed with COVID. We require folks to have Medicare health insurance and that their income is below the 400% federal poverty threshold. And then, of course, the US residency component. So just like with our other programs, just give us a call. One specific note about the COVID program is we're only accepting applications via the phone right now. So if this is something that's of interest to you, just give us a call and we'll be more than happy to help. There's a lot of information out there about how to manage your disease. And one of my favorite things to talk about is our relationship with the Parkinsons Foundation and how we work together. Folks who come to us for assistance from PAN are not only faced with financial concerns about how to pay for their medications, but they might have questions on how to manage their disease. They might have other financial needs that they want to get addressed, such as rent or housing or anything related to that. They might also just be looking for someone to speak with to understand more about peer support groups or counseling resources. And that's why our partnership with the Parkinsons Foundation is so valuable. We're able to partner with them to make sure that the patients that we serve are receiving holistic care. And so if you are applying on behalf of yourself, what you can do is when you enroll, there'll be a question at the end of your application that says, are you interested in learning about or receiving educational support services from the Parkinsons Foundation? And if you say yes, what we'll do is we'll provide your information to the Parkinsons Foundation, and a member of their team will be able to follow up with you and work with you to make sure your questions are answered and that you can get the support and care that you need. This is something that we're very proud of because we recognize the role of care goes well beyond just finances, and we're here to help. So even if you are not able to secure a grant from the PAN Foundation, what we'll be able to do is still work with you to make sure that you can get connected to the resources that you need. So definitely give us a call or let us know online if this is something that we can work with you on. So one of the other great things about the PAN Foundation is that we not only provide copay assistance, but we also provide healthcare premium assistance and for insurances, as well as travel assistance. So these two programs, just like with our copay programs, are limited to specific diseases. And so right now, we don't have premium or travel programs for the Parkinson's Fund, but we are very interested if this is something in trying to support it, if this is something that you think might help you. So let us know, and hopefully in the future, it's something we'll be able to work with you on. The PAN Foundation is just one of the many resources that can help you gain access to financial assistance for your out-of-pocket costs. There are about 8 other national charitable foundations that are able to support you. And we want to make sure that you are connected with the right organization that can cover your treatment and provide you with assistance. The eligibility criteria for these programs can vary even if multiple foundations cover the same disease. So we were thinking over the last couple of years, how can we make sure that we get this information in the right hands and help people? Because if there are so many different foundations, how can you stay on top of every single one with a different criteria and learning when these programs open, because all of them do open and close throughout the year. And that's why a little over a year ago, the PAN Foundation created Fund Finder. Fund Finder is the first free web application that anyone can use to find out when charitable foundations open or close. You can sign up for free by going to fundfinder.panfoundation.org and definitely check out the links below in the comment section for that URL. And what you'll be able to do is once you create an account, you'll be able to search for the disease that you're interested in and be able to see which foundations cover that disease state. So if you go on and search for Parkinson's disease, you'll be able to see how many foundations have Parkinson's disease. And then you'll also be able to see whether that program is open or closed. We update Fund Finder on an hourly basis. So no matter which day it is, whether it's the weekday or the weekend, you'll be able to see whether that program is open or closed. And more than that, you won't even have to log in to get this information after the first time, because if you sign up, what you can do is you can follow the fund by subscribing to it once you're in Fund Finder. And what that will do is it will send you a notification by text or email whenever one of these foundations open. So while the PAN Foundation is open right now, let's say that in a few months it's not open, and then it opens a few days after it closes. If you're signed up, that means that you'll get a text message or email letting you know this program's now available, and what you'll be able to do is reach out to us then. So we really want to take the burden off of you having to check the websites or call the foundation. So definitely a great resource to check out. Like I mentioned, it's free and anyone can use it. So you could use it, your family, if someone's helping you with your care, or a friend could use it as well, or your healthcare provider or pharmacy. Thank you so much for joining us today. I had a great time sharing our resources with you, and I hope that you check them out. I encourage you to reach out to us if there's anything we can do to help you, or if you have any questions about our programs. And please do reference the comments below for the links for the programs that I spoke about. Thanks so much, and talk to you soon.